Many of us aspire to be as healthy as can be. But what are some of the things that you can do to improve your health? Let's talk about how our lifestyles can affect our overall health and well-being. Before we get started, let's take a brief look at the health status of adults in America. What do you think this stethoscope represents when we are looking at healthy habits? Yes, it represents preventive care. Unfortunately, only about 8% of adults are getting all of the recommended preventive services with the greatest potential for improving health. Yes, that means that 92% are not. This includes preventive services like blood pressure and cholesterol checks, screening for osteoporosis and several cancers, as well as vaccinations and more. Amanda Borski of the Agency for Healthcare Research and Quality indicates some of the commonly known reasons for not getting recommended preventive services include lack of health insurance, lack of a usual doctor or nurse, and problems with healthcare delivery, including wait times in clinics or doctor's offices. Adults should be proactive and ask their doctor or healthcare provider what preventive services are recommended for them based on their age, sex, and medical history. Think about preventive service that you have performed on your car. Our bodies are the same. We need to do basic things to keep our systems running well for a long time. The good news is that more than 20% of adults reported receiving more than 75% of the recommended services, with some services faring better than others. The rate of blood pressure screening was close to 90%, for example. And we all know what this represents. Yes, tobacco smoking. About 14% of the adults in the U.S. smoke. In Pennsylvania, about 17% of adults smoke. So we are a bit higher than the national average. The good news is that this has been going down since the Surgeon General's report on smoking was released in 1964. In fact, we have more than 10 million fewer smokers since 2000. Of course, some quit, others weren't so lucky. However, e-cigarette use is on the rise, along with concerns about their potential health risks, particularly among our youth. Almost 24% of our high school students in the U.S. use tobacco products. If cigarette smoking continues at the current rate among youth in this country, 5.6 million of today's Americans younger than 18 will die early from a smoking-related illness. That's about 1 of every 13 Americans aged 17 years or younger who are alive today. And how about this screen? Yes, this represents inactivity. About 47% of the adult population does not get the recommended level of aerobic physical activity. We will learn a little later this semester exactly what the recommended level of aerobic physical activity is, and my hope is that many of us will be on our way to meeting this recommendation. And if you combine that with muscle strengthening activity, about 77% do not get the recommended level of physical activity, including both aerobic and muscle strengthening activities. So, pretty much, if you are not meeting recommendations, you are in the majority. And of course, this is proper nutrition. About 90% of American adults do not meet the intake recommendations for vegetables. And about 88% of adults do not meet the intake recommendations for fruit. Not to mention that obesity rates are currently at about 42% for adults in the U.S. Actually, our diet comes primarily from processed foods, about 55% of our calories. We only get about 5% of our calories from fruits and vegetables, or natural produce, when you take out white potatoes. Research shows that consumption is even lower among men, young adults, and adults living in poverty. You guessed it. This represents stress. 3 out of 4 adults report experiencing at least one stress symptom in the last month. 45% report lying awake at night. 36% report feeling nervous or anxious. 35% report irritability or anger. And 34% report fatigue due to stress. So, where do our health habits leave us? Well, let's take a look at health in the United States. When we look at health statistics, we often look at life expectancy and causes of death. You are more than likely aware that our life expectancy has drastically increased in the last 50 years in the United States. In the 1800s, the life expectancy of Americans was less than 40 years and substantially lower for African Americans. The predominant causes of death during this time were malaria and tuberculosis for adults and measles, mumps, and whooping cough for children. Today, all of these diseases are preventable. An interesting fact, during the War of 1812, more soldiers died from disease than fighting. In 1900, life expectancy in the U.S. climbed to 46 for males and 48 for females, with the leading causes of death being influenza and pneumonia, tuberculosis, diarrhea, and enteritis. Not much progress was made before the 1900s. During the 20th century, however, the average lifespan in the United States increased by more than 30 years. By 1950, our life expectancy had risen to 66 for males and 71 for females, and continued to rise until 2014, when life expectancy reached 77 for males and 82 for females. Take a look at the causes of death from 1950 on. You see heart disease, cancer, stroke, and respiratory disease dominate the leading causes of death in the United States. So, as public health initiatives expand, technology improves, and advances in medicine and medical procedures improve, life expectancy also grows. With these changes, we also saw a shift in the major causes of death and disability from infectious disease to chronic disease or lifestyle disease. Chronic disease now accounts for 7 out of every 10 deaths in the United States. Positive lifestyle habits have the potential to help control premature death and disability and to improve health and well-being. Here's the breakdown. Cardiovascular disease and cancer account for 50% of our deaths in the country, many premature. As we saw, we are now dying of chronic diseases, which are caused by our unhealthy lifestyles. There are many lifestyle diseases in the other 50% as well. Here are the 4 leading causes of chronic disease: poor diet, inactivity, excessive alcohol consumption, and tobacco use. These modifiable health determinants are the 4 most significant factors leading to chronic disease among Americans today. I understand you are young and chronic disease is a long way off. I would propose that beginning now is your best defense. We will pick up with health behaviors and determinants of health, or what really drives our health status. But first, let's take a look at one of the infectious diseases that has had an impact on all of us. You may be wondering how COVID-19 has affected our life expectancy and our leading causes of death in the United States. Let's take a look. I mentioned earlier that life expectancy topped out in 2014 at 77 for males and 82 for females, at almost 79 years for both males and females combined. Life expectancy declined slightly each year until 2018, when it once again started to increase. While a few factors contributed to the drop between 2014 and 2017, the good news is that the reduction was offset by decreases in mortality for cancer, heart disease, and influenza and pneumonia, which could mean that we are slowly chipping away at chronic conditions and learning how to combat infectious disease. As you suspect, life expectancy took a hit in 2020.
Between 2019 and 2020, we had a decrease of almost 2 years. Since 2020, our life expectancy has been steadily increasing. However, we still rank fairly low when compared to other countries in the world. In 2022, our life expectancy in the U.S. is at about 79 for both males and females, which is about 6 years lower than Hong Kong and Japan, who are first and second in the world. In 2020, heart disease and cancer remain the leading causes of death in the United States, and COVID-19 comes in as the third leading cause of death, with about half the number of deaths as heart disease. This puts an infectious disease in the top 3 leading causes of death in the United States. As our response to COVID-19 evolves, the number of deaths will continue to fall. Scientists were able to quickly develop a vaccination based on research that has been in the works for years. We have also seen more accurate and accessible testing and treatment, as well as masking requirements and physical distancing adjustments, as we get a handle on how to manage COVID. No doubt, COVID-19 has had a huge impact on all of us, outside of the physical effects, touching every aspect of our life, including social, psychological, economic, and more. Throughout this course, we will focus on how we can reduce our health risks and improve our overall well-being.